Hello, my name is Vikhyat Jain, a fourth year undergraduate of International Higher School of Medicine. On the day of 28th July, we celebrate World Hepatitis Day because it is a birthday of Dr. Bloomberg, who discovered hepatitis B virus and also developed diagnosis test and vaccine for the virus. In India, 40 million people are infected with hepatitis B and around 10 million people with hepatitis C, which leads to the death if not treated properly. The main aim of World Hepatitis Day is to spread awareness about hepatitis and achieve countrywide elimination of hepatitis by the 2030. And being in the medical profession, it is our duty to educate and encourage people for the prevention of disease and make collaborative efforts to eliminate this disease as public health concern.
Hepatitis is the infectious disease mainly classified as hepatitis A, B, C, D, and E. Our main aim is to achieve the elimination of hepatitis B and C virus by the 2030. And being in the medical profession, it's our duty to educate and encourage the people for the prevention of the disease. From here now, my colleagues will give you the detailed discussion about the hepatitis.
Hello everyone. So today's my topic is autoimmune hepatitis. It is a chronic liver disease which is characterized by inflammation of liver caused by an abdominal immune response. In this condition, the body immune mistakenly attack the liver cell. The mode of the transmission of autoimmune hepatitis is injection drug use, unsafe medical procedure, sexual transmission and the vertical transmission. Antigens. Antigens are anti-nuclear antibody ANA, anti-smooth muscle antibody SASMA, anti-liver cytosol antibody SALCA, anti-soluble liver antigen SLA. Symptoms include in this disease are loss of appetite, nausea, vomiting, abdominal pain, malaise, jaundice, superinfected HDV in chronic HBV carrier, and the clinical features for the autoimmune hepatitis is it is considered superinfected when it occurs in conjunction with HBV oral co-infection. When it occurs with the HBV, co-infection with HBV and the HDV. Diagnosis for this disease are medical history, physical examination, autoimmune testing. This includes anti-nuclear antibody ASMA, liver function test, immunoglobulin level of IgG by the blood test, liver biopsy and the CT scan and the MRI. Thank you.
Hello everyone. Today I'll be telling you all about hepatitis B. What it is, what are the specific antigens present in the disease, what are the clinical features of the disease, and what are the diagnostic criteria for investigating about hepatitis B. So let's begin. Hepatitis B is a viral infection which causes inflammation in your liver. The etiological agent which causes hepatitis B is the virus hepatitis B itself. We know the causative agent of this disease is hepatitis B virus, but we should be knowing the routes of transmission of it, and it is via the contact between the body fluid and the infected blood. Also, it is through mother to the child, and it is also due to the unsafe dental or the medical procedures, and etc. The antigens present in hepatitis B viruses are as follows.
HBS antigen, HBC antigen, and HBE antigen, where S stands for surface and E stands for envelope.
The clinical features of hepatitis B, which you can see in this patient, are as follows. In acute hepatitis B, you can notice fatigueness, loss of appetite, nausea and vomiting, abdominal pain, malaise, jaundice, muscle ache, and fever. And the specific feature about this part is the presence of dark color urine and pale color stools. In chronic hepatitis B, you can still observe fatigueness, loss of appetite, jaundice, but it can also lead to further complications like cirrhosis and liver cancer. Let's move on to diagnosis. The key features of diagnosis includes medical history primarily. Next, we need to do further physical examination to assess signs of liver disease. In test, you need to do hepatitis B serological test, which aids in identification of certain antigens, also quantitative viral load testing. In some cases, you can even do MRI, CT scan, or a liver biopsy.
Hello everyone, today I will tell you about hepatitis C. So let's start. Hepatitis C is caused by hepatitis C virus and primarily transmitted through infected blood. Antigen present in hepatitis C are HCV4 antigen. Hepatitis C virus 4 antigen is highly conserved across HCV genotype. Clinical feature of hepatitis C which you can see in patients are these. In acute hepatitis C, we can see fatigue, nausea and vomiting, malaise, jaundice, and loss of appetite. Like hepatitis C, it occurs infection persists more than 6 months. The key feature of diagnostic includes medical history, physical examination to assess liver disease, liver function test, hepatitis C serology test, and in some cases MRI, CT scan, etc.
Hi, my name is Filza Mahmood and I am from 6th semester. Today I am going to tell you about hepatitis D. Hepatitis D is caused by hepatitis delta virus. It can occur in those individuals who are already infected by hepatitis B. Its antigen is delta antigen, and delta antigen is found in two proteins that are small and large. Small protein has a replication function and large protein has a regulatory function. It can occur in two ways. Number one is co-infection and the other is supra-infection. It may lead to the severe liver diseases. It can also cause the acute exacerbation of chronic hepatitis B, and it can lead to the progression to the liver cirrhosis, and there is a risk of hepatocellular carcinoma. Its mode of transmission: injection drug use, unsafe medical procedures, sexual transmission, and vertical transmission. Its clinical features: it is considered as the superinfection when it occurs in the conjunction with HPV or a co-infection within the HPV. Co-infection with the HPV and HDV. Its symptoms include loss of appetite, nausea and vomiting, abdominal pain, malaise, jaundice, and also may occur. It is less common. Jaundice is less common. Superinfection of HTV in chronic HPV carriers. Its medical history: physical examination to assess the jaundice, hepatomegaly, hepatitis D serology test, hepatitis B serology test, liver function test, CT scan, and MRI.